Hello, everyone. Welcome to the second session of Leadership Development in Occupational Therapy. Make sure that you have already watched session number one because a lot of the materials that we're going to be talking about in this session kind of builds up upon the first session. So make sure you watch all the sessions in a chronological order. Now, when it comes to leadership and occupational therapy, I think it's really good to apply models, especially the Kava model that we talked about in the previous session. But in this session, we're really talking about the occupational adaptation model. So this is a very simplistic version of it. There's a lot more to it. But the occupational adaptation theory focuses on the internal process of adaptation, right? The utilization of this theory can help novice occupational therapists become better leaders. This model is appropriate because this theory is all about helping the clients make adaptations to enhance participation in meaningful occupations and activities. The occupational adaptation theory is relevant to new OT leaders because being a new leader is very challenging, especially if you don't have too much experience being an occupational therapist to begin with. And the key to this theory and its application to leadership is that the more adaptive that they could become as leaders, the more that they will achieve, the more functional positive outcomes that an OT leader will achieve. So essentially, there's demands, there's desires, right? And there's a press for mastery, and everything interacts with the person and the occupational environment. The main three components that you really want to think about when it comes to occupational adaptation model is the sensory motor, cognitive, and the psychosocial elements of this model. And these domains, they interact with the occupational environment. And these environment, um, they include physical, social, and also the cultural environment. This program will aim to establish like the mature adaptation that represents goal-directed behaviors that leads to an adaptive response. There's a relationship between occupational self-efficacy, leadership behavior, and preparedness for occupational change. And I believe that this model really exemplifies that. Self-efficacy involves initiating of a behavior, persistence, and effort. Now, with enough of this motivation, this results include very vicarious learning, improved verbal skills, and mastery of an experience. This is an example of occupational adaptation, right? The environment is also an important element when it comes to occupational adaptation. And the environment will determine the occupational performance just as much as the person's self-efficacy or their desire to achieve mastery. Now, when it comes to engaging self, now this portion of this program is extremely subjective. Um, there are a lot of thoughts and feelings that I might be sharing, and I want to get into it. So, when it comes to leadership philosophies, right, this is kind of how you see yourself as a leader. And not just how you see yourself as a leader, but the your goals of aspiring to be the best leader possible. Does that mean that you're a terrible leader right now? But no, it means that there are ways that you can improve your leadership skills. And that has always been my philosophy. I'm not talking about leadership theories. I'm just talking about the philosophy of leadership, right? It's a very internal process of being a leader, of taking responsibility and also staying accountable to yourself. Now, many authors reference that leadership is a journey rather than a destination. And there are five key elements when it comes to leadership. So the first one is awareness, also referred to as self-awareness, right? This is the conscious recognition of your own character, your own values, your own emotions, your own behaviors, your own strengths, and your own weaknesses as well. Reflection, this is an active cognitive process of reviewing, analyzing, and interpreting specific experiences, actions, and decisions so that you can learn from it. Now, leadership aims represent the core objectives, right? These are your visions, moral targets that leaders seeks to achieve for themselves and their team. Validation is a process of proving, verifying, or confirming that your theory, your methodology, your piece of data, the decision that you've made is accurate, reliable, and compliant with established standards. Informed practice, also called evidence-informed practice, right? This is an approach to decision making where professionals integrate the best available research, technical evidence, and practical experience as well with the values and constraints of their specific environment and their clinical setting. Now, when it comes to types of leaders, the first one I really want to establish here is the heartfelt leader, right? These leaders, they really focus on the outcome of transformation through intention to empower others without being dominant. Empowerment is crucial in leadership as it can create greater independence and increased sense of control for your colleagues and clients over their own lives and over their own employment. Heartfelt leader is someone who offers his or her authentic self, grounded in an emotional connection that engenders trust, commitment, and engagement. They lead with their eyes, ears, heart, mind, and an open soul. They believe that every member is a leader and view leadership as a collaborative journey of self awareness and a compassionate service. These heartfelt leaders are extremely passionate. Sometimes they could also come across as a little bit too passionate, um, but their heart is in the right place. And they want to see you succeed and they want to see their organizations succeed. Now, you're probably asking me, how does occupational participation tie into heartfelt leadership or heartfelt leaders? Well, we as OTs, as all OTs, we are looking at our patients and clients with a certain type of lens, and that lens reflects the OT code of ethics, core values, and principles. Well, these heartfelt leaders are also applying that to essentially all their subordinates, to all of their followers. So, heartfelt leader is very, very close to the profession of OT. Um, and they also utilize a strength-based approach to leadership, right? They really focus on the autonomy of their clients. Um, I mean, as OTs, we focus on the autonomy of the clients. As Hartford leaders, they really focus on the autonomy of their employees. And they typically utilize a strength-based approach to enhance their skills to overcome barriers to occupational participation and performance. This method of thinking provides OTs with a unique insight and value into the healthcare field. It becomes more than a responsibility, but rather a duty to become a stakeholder to promote the quality of care, right, and the quality of life. And Hartford leaders are doing that for the OTs and PTs and other professions that are working underneath them. Their main focus is to improve the quality of care and quality of life for their employees and for their clients. Now, utilizing the same philosophies for patient care within the profession of OT, OTs can enhance organizational success and outcome just as much as they can enhance client success and client outcomes. And this is done through really empowering the employees of an organization with that heartfelt leader mindset. Now, the next type of leadership I want to talk about is considerate leadership style. Now, considerate leaders are characterized by inspiring and empowering others while creating a comfortable and efficient work environment. Now, these leaders, they value the perspective of their colleagues and they may even value it over their own perspective. Um, this type of leadership is consistent with the core value also consistent with the core value of the profession of OT, which is to promote individual empowerment and autonomy, right? They really, really focus on relationships, employee well being, mutual trust, and open communication. Now, when it comes to considered leadership style, these leaders treat themselves as equals rather than mere subordinates, right? They respect the personal values, the personal expertise, and boundaries of their staff. They maintain an open door policy. They're very easy to talk to. They do little things to make work environment pleasant and warm. Um, Team members often feel safe coming to them with both professional challenges and personal issues. This style creates an environment where people can speak up without the fear of negative consequences. The leader actively listens to diverse perspectives and encourages team members to express their thoughts, even though their thoughts might differ from their own. Information and knowledge are shared and are shared freely and transparently. They show genuine care for their employees' career development, their work-life balance, and their mental health. They are quick to offer help and provide advance notice of major organizational changes. And they also assist in clearing big obstacles slash roadblocks. So they're very involved leaders. The next form of leadership I want to talk about is informal leadership within a workplace. Now, these leaders, they lead more with merit rather than a position of power. They are often not like managers or rehab directors. They can be, but they're often not. They cannot often delegate tasks, hand out official promotions, or enforce um, disciplinary actions, but they rely entirely on their personal influence, right? Informal leaders are often always highly competent, experienced, and knowledgeable in their specific domain. So they're essentially subject matter experts. They possess deep technical or procedural knowledge. When any team member of the team faces complex tasks, obstacles, or they need guidance, they spontaneously seek out this person for answers because they trust their judgment. Um, an informal leader is not appointed, right? They step up during a crisis or during a complex problem or when the formal leader is absent or lacking. They adapt their style dynamically based on the group needs at the exact moment. They typically go into two different types of leadership styles or like domains of an informal leader, and that's calming or granting. So the calming informal leader, this individual proactively steps up, speaks out, takes consecutive actions beyond their designated pay grade, essentially, or their or their role. And then the granting informal leader, they manage their peers, um, their peers and their managers. Sorry, they actively accept, respect, and they heed the individual's guidance. Um, they almost do that without like peer validation. So essentially, they let this person make higher organizational decisions. Um, how it works? Well, these are excellent empathetic listeners who practice active sensing. They understand the politics of a situation, right? And they emerge naturally. Um, and they communicate with tact, which often makes them feel safe and supportive. So informal leaders, excellent types of leaders, they, usually are getting paid just as much as their counterparts, but they step up when they're truly needed. And they self-initiate a lot. And they're also change oriented, right? They're very adaptive to new changes within an organizational structure or within their routines. Now, talking about informal leaders, I think it's also important to mention informal positive interactions within a workplace because this is really going to determine how others view you as a leader or even just as a coworker. So first, I want to point out are just like check-ins, right? Like, how are you doing? Go in someone's office and just ask them how they're doing can go a very long way. Um, Second one are inclusive welcome, right? Like if someone is at the door of your office, taking a chair out for them, nodding, you're just giving them a smile and making eye contact can go a very long way. Spontaneous invites. Um, my program director slash rehab director does this very often. He will just out of nowhere come in my office around noon. I'll give him a smile and he'll be like, "Hey, you want to go for lunch?" So, those types of spontaneous interactions can go a very, very long way. And they typically will help you build rapport with that individual as well. Pre-meeting interactions, right? Before the meeting even starts, like having a conversation about a topic or what you did over the weekend or what they did over the weekend can go a very long way on just creating positive professional relationships within a workplace before the meeting starts, obviously. And these things that you're going to be talking about are not going to be work related at all. So, just a few minutes of a conversation non related to work. Letting others speak. So, this often happens when you often create like just almost like a moment of silence, right? When someone comes up with an idea, as a leader you shouldn't just jump right in to give your opinion. You should probably give it some thought, and if others in the room have, also give others in the room some time to process what has just been proposed, instead of trying to just jump into the conversation and dominate the conversation. So really giving others an avenue to speak rather than just having your own input right away can actually lead to better organizational outcomes. And validating inputs, right? Like if someone says, hey, for example, someone is pointing out how to solve something, and you can, as a leader, almost say that, hey, yeah, I really agree with this person and I really like what they just pointed out. That makes a lot of sense. Nodding and smiling while they're also speaking can also go a long way of initiating slash bringing out confidence within your team members. So these are just some of the informal positive interactions that I feel like are essential within a workplace. And if your workplace doesn't practice these, maybe you should be the one who starts it. And we'll see how quickly this positivity, spreads, because it's contagious. Once you're able to really bring in everybody, everybody will also start to follow. So give it a shot. So these are some key elements to facilitating leadership development. Now, it requires a leader to value the unique, diverse expertise of every contributor, including the client as the expert of their own life, right? So, collaborative OT leaders break down professional silos and use shared decision making to optimize clients' occupational performance and participations across the environment and context. Now, professional confidence, right? It is built through reflective practice, hands on clinical experience, and continuous learning. A confident OT leader will not hesitate to articulate why an occupational perspective is necessary in a meeting. They trust their clinical judgment in complex situations and, and often project a sense of efficacy that inspires trust in clients and colleagues alike. Now, mentorship. Unlike basic supervision, which focuses on compliance and task management, OT mentorship should really focus on the person. It utilizes a coaching model to foster self-reflection, build resilience, and pass on tactical learning, unwritten wisdom of clinical practice, right? The things that are not going to be evident from just going through your routines of being an OT. And this is to ensure sustainable growth of the profession of occupational therapy. Communication. So OT leaders practice advocacy. Advocacy. OT leaders practice advocacy on multiple levels. Locally, securing adaptive equipment or extra therapy sessions for a specific client, even if they have, their insurance will not cover an extra session. Some OTs really do go out of their way to provide them that extra session. Professional like advocacy. This is educating other medical professionals on the distinct value of what an occupational therapist can bring to the table. And lastly, communication, right? This is the core component of therapeutic use of self. An OT leader must seamlessly code switch, right? Communicating with clinical precision um, to a physician about something important about a client, writing evidence-based reports for insurers, and translating complex neurological concepts into comforting plain language for our worried parent or patient that do not have the proper level of health literacy. So, extremely key components when it comes to facilitating leadership development. Many OTs are promoted to senior or management roles solely based on their clinical expertise or experience, but they receive little to no informal training on how to lead. Now, these are just some examples of what hinders leadership development in novice occupational therapists. So, informal training, right? These include microlearning moments such as either shadowing a senior leader, peer-to-peer discussions, or given low-stakes opportunity to lead small projects or committee. Clinicians are often left feeling unprepared, and this leads to high stress, burnout, and almost a reluctance to take on future leadership positions. Also, high productivity standards. So, understaffing and heavy clinical workloads have seasoned OTs with no time or space to mentor younger colleagues. And mentorship becomes a luxury rather than a standard practice. This deficiency stunts the growth of the professional confidence of newer therapists. Like without a trusted mentor to offer feedback, challenge their perspective, and advocate for their growth, emerging OTs are struggling to develop their own leadership identity. They are less likely to step out of their comfort zones to innovate or advocate for their clients on a systemic level, just because there isn't enough time within their workday. There's also a distinct lack of clear structured pathways to show how OTs can transition from a staff therapist to either a supervisor or a rehab director. Organizations often fail to define what competencies they require to advance their careers. Like examples of these competencies include financial management, policies, policy education, or strategic planning. Highly skilled therapists either leave the organization, causing retention issues, or they remain in clinical roles without ever realizing their true potential of being a leader. Now, mentorship can create more leadership opportunities for occupational therapists seeking to pursue a leadership position. Mentors can serve as a support system for occupational therapists seeking or transitioning into a leadership position. Along with an organized support system, confidence, and knowledge, this can be gained, all these aspects can be gained through a mentor and mentee relationship for practitioners transitioning into leadership positions. While mentors may appear to have more to offer to mentees due to their experience and success, the mentor and mentee relationship is often transactional, which involves sharing ideas, perspectives, and knowledge from both parties. Successful mentorship occurs when both mentor and the mentee find value and mutual benefit from their relationship and interactions. Now, A mentor doesn't just give you the right answers. Instead, they use a coaching model to help the mentee dissect their clinical decisions. They guide the mentee to think critically and clinically about why they chose a specific intervention or decision that they made and how it aligns with occupational therapy theory. Now, effective mentorship structures deliberate opportunities for mentees to self reflect. Mentors guide mentees to examine not only their clinical successes and failures, but also their personal reactions, biases, and emotional triggers. This builds the therapeutic use of self, which is a core concept in the field of occupational therapy, and it's more important than ever and is crucial for patient care. Mentors must be approachable, empathetic, and trustworthy. They need to be able to offer non judgmental, active listening, validation, and emotional support. Mentors help mentees navigate the moral distress, high productivity pressures, and burnout common with the modern healthcare setting. A great mentor identifies the unique strengths of the mentee and actively pushes them towards professional development. This includes introducing them to professional networks, involving them in research, teaching them how to advocate for the distinct value of OT to the interdisciplinary teams and also policymakers. So, mentorship is a cornerstone for leadership development, and every novice occupational therapist should pursue some type of mentorship. Now, when it comes to professional relationships, we interact with a lot of different professions. And it's very important to build good professional relationships in order to be a good leader. Now, let's say someone asks you, what is an occupational therapist, right? If you see a nurse ask you that question, it's really important to not just tell them, but really show them the value that you bring um, as a profession and as a professional to this patient that you're treating. Don't just, it's really important to not just give them a textbook definition of the OT, right? Demonstrate your value through patient outcome. Now, when it comes to co-treating, really great means to create rapport with your coworkers. Um, I often co-treated with the physical therapist, right? Like, let's say if they are working on balance, you can have them work on balance while you're working on grooming, standing at the sink. So, they are focusing on biomechanics, you're focusing on an occupational task. Just something like that can has for me probably been the most successful way for me to build rapport with a physical therapist. um, Communicate, right? Communicating also based on context. So if you're talking to a doctor, you need to give concise and data driven information, like this patient needs maximum assist for bathing. But if you're speaking to a discharge planner, right, you need to focus on things like safety, right, or equipment needs. So context is really important on how you're communicating with everyone around you. Now, offer to do, like, help others also understand the OT scope of practice, because not many people do, um, especially in the healthcare industry. So, offer to do a quick, brief 5-minute in service um, on techniques like safe transfer techniques, splint positioning, or even sleep hygiene. This really depends on your clinical setting, but I highly recommend that you do something like that because it's going to show them the value of OT, and that's going to further our great profession of occupational therapy. So, this will be it for session number 2. I will see you all in session number 3.